Today I've been most interested in finding out a bit more about the biobanks and how they're going to deal with the tissues that are deposited with them.
I just found it really, really interesting to find out about the process and what it's for, what it's done, what's done with it, what happens to it, and I am pleased that I have the information, even though none of it, just even things like knowing the risks doesn't put me off, but I'm pleased that I have that information.
And knowing that there's like a panel, a board that it needs to go through, that your personal data is not shared, so it's anonymous.
I suppose that one of the more reassuring things I found out about biobanks is a lot of them are actually based in hospitals and universities, and that they're in the public control.
I was a bit surprised that people are so concerned, and lots of information's actually readily available.
I didn't know that they had to have like a committee, an access committee, to access data, but that stood out in my mind as being something that I liked knowing.
The level of detail and an effort that needs to go into making sure that everybody's data is ethically used and not shared in the right way. That's been the biggest surprise for me.
I think they need to future-proof the system when they're looking at how they collect their data. Technology changes and advances are made so quickly that if they're not careful, then they're not going to be able to actually address the problems as they arise.
Obviously confidentiality, but also transparency. We could openly give a sample if we think we're doing it for the good of the country. But I'm not sure I'd feel the same if I was giving it and I knew it was going to a private pharmaceutical company.
I think knowing the benefits of the research and kind of publicising those a bit more would definitely encourage more people to donate, or would offset those kind of the worry of those risks maybe.
For me, it needs to be more clear and there needs to be more access, so please see this website for more information about how the information is passed on, what journey it takes. Would you like information as where your tissues have been sent off to?
For myself, I don't mind what information goes out there, but they've got to be sensitive to people's concerns about how the tissue is going to be stored, how is it going to be used, is anyone else going to have access to their information?
I'm a great supporter of national health, so I'd like to see that nothing that would undermine the national health, really. That's what I'd like to see. But I think that document, that leaflet, does explain things in pretty, user-friendly terms.
Things like where your tissues could end up. I don't think it makes it clear. Yes, it says it can go to universities or it can go to hospital research centres, but then it also says to medical companies. The word private's never mentioned.
I think on the consent form, if it clearly stated that this is where your information was going to be supplied to, these are the types of organisations that we work in conjunction with, so people got more an informed choice.
I'd like to know that my tissue is not going to be bandied about all over the place, or if it is going to be moved or used by someone else, I'd like to know about that.
You don't want too much information, but you want enough information that you are making an informed choice.
There are safeguards in place, but just, explain to people that, of courcourse, that sometimes a human error happens, but that there are procedures in place, and if anything like that did happen, just kind of reevaluating the system and thinking about what went wrong and how that can be avoided.
I think if I know it's from a trusted name like the NHS or one of the trusted leading health brands, then I probably would feel quite comfortable doing it.
I think it needs to be a lot more clearer as to where those tissues are going.
They want biobanks to keep going, research to keep going, so they're going to do their best to keep information secure. So yes, I think they are.